Hi, this is Ashley with Equine Massage Lesson 7 Part 3. Today I will be using a gelding named Hanley. He is a 19-year-old appendix. The reason why I chose him is because his owner stated that he does have consistent lameness in his front left, as well as his back end can sometimes be a little off as well. He does have to have shoes, just because it seems to be working the best for him for soundness wise. He does not do much work. He works maybe about a handful of times a month, and that is why I think he will be a good candidate for this lesson. By looking at Hanley at a standstill, I can tell that he does not square up naturally. He does have his left hind caked forward a little bit, so that tells me that he might have some soreness in his hip. I do know that is the side that he typically does go lame on as well, so I think that might be a part of it. I can also see that he might be standing a little forward on his forelegs, and I think again that's compensating his hind end not being able to naturally stand. I also do notice that his top line isn't the greatest, but I think that's just because he doesn't work that much. And I imagine that he is probably pretty hollow when he does work. Looking at Hanley at a walk on the lunge line, I can tell that he does not track up nicely on either end. His left is definitely worse than his right, which is the hip that he was not able to track up well on. He does hold his head kind of low, which is a good thing, but then he also does cut his corner a little bit. I can also see in his top line it's a little weak, but I think that's just from lack of working and everything like that. And I can tell just by him walking, he doesn't seem to be very comfortable. He does move like he is stiff. Picking up the trot again, he's cutting his corner, making his circle smaller. He is able to go ahead and stretch out his head a little bit, which I do like, and I know she is training him to do that. So that way he can be more comfortable under saddle and strengthening up his hind end and back. I do notice that he still just seems a bit stiff. I don't really see pain, but I don't see a good natural flow for him as he's moving forward. He does struggle to pick up his canter a little bit, but then once he does pick it up, it's pretty nice. I could still see him being just a little off though. His hind end is not reaching underneath himself as much as I would like to see him doing it. His head does bob a little bit during the canter. It's not really stretching out. It is a bit hollow. He seems to be just having a little bit of a struggle of keeping a nice pace with this canter. Directions as he's walking and going into his trot, I still do see some stiffness going on. It could be soreness, but I will know more obviously when I begin to work on him. I do see that he does not track up nicely still. He might be a little bit better now that he's warmed up a little bit, but it still isn't perfect in the way I would like to see him. Again, his head is not stretching down. It's a bit hollow, which is making the rest of him a bit hollow and uncomfortable. He does pick up his canter a lot better in this direction, so that makes me believe that it's his left hip that is affecting him more than his right. And I do like the way that he moves better going this way, but again, he did get warmed up a little bit going the other direction, so that might be a part of it. His muscles might be starting to loosen up a little bit more than what they were when we began. To begin my massage, I will begin at the pole, and I will just do some friction and a little bit of compression, just seeing how much pressure I can put there. It is where multiple muscles meet, so I do imagine that they are pretty tense and everything up there, especially since he is a cribber. So I am feeling a little bit extra tightness than what I did in my previous horse. And my previous horse was not a cribber, so I'm sure the cribbing has a lot to do with it. He does seem to be a little alert and probably paying attention to something else, but I do notice a soften in his eye the longer that I do work on his poll area. I'm not getting any type of reaction, so I know he's not feeling any type of pain. He's just kind of trying to figure out what's going on. Move on to the jaw joint, and I am going to do some friction and muscle combing in this area. I'm just going to rub my fingertips up and down his cheekbone and getting all those muscles to loosen up and start feeling a little bit better. And I do see that his eyes are definitely starting to quiet a little bit more, so I know he is enjoying it. He did just get his teeth done about 2 months ago, so I know he is up to date. And we do seem to be getting some licking and chewing now, so he's definitely getting some releases in there. Since this is where multiple muscles meet in the jaw joint, the zygomatic and the masseter muscles, there is very common for there to be trigger points in this area. And the more that I see him licking and chewing, the more I know that he is releasing some of those. He has a nice droopy lip and looks like he's ready to fall asleep as well. Move on to the forehead, and I just do some basic effleurage in that area, going in a circular motion. And I could tell that he is definitely enjoying this. He's very quiet and relaxed at this point, which is a good setup to get him ready for the rest of his full body massage, especially when we get into those more stiffer areas, and I suspect there might be a little bit of soreness as well. I then move on to the withers, and in this area I will begin doing some effleurage, and I am doing a lot of deep effleurage in this area as I'm not getting any type of pain reaction from him, so I'm just going to keep going as deep pressure as I can. Really noticing anything jump out at me as far as trigger or stress points in this area. He's not having any type of reaction with pain, so I will then move on to friction. And I do this in a circular motion because the muscles in this area work in opposite directions, and you want to make sure you get both muscles at once, and you want to make sure that you are working the muscles correctly. Muscles are the rhomboid as well as the trapezius, and what they do is they attach to the shoulder blade, which attaches to the withers. And when you are doing the circular friction as you go across, you are spreading the muscle fibers, and then the opposite direction that you are doing in the circular friction is you are stretching the muscle when you go in the other direction. Move on to the long back muscles, and here I just kind of see if he's any type of back sore. I run my fingertips down with some pressure to make sure that his saddle is not pinching anything, because if they were, he would definitely hollow out his back and seep down into the pressure, which would indicate that he is definitely sore, but I am not seeing that at this moment. And then move on to doing some deep effleurage just to kind of see if I can pinpoint any type of stress points or trigger points in this area for the long back. And then I do begin doing some friction with my fingertips. I am going pretty deep into the muscle since he is able to tolerate it, and I do want to try to get as deep as I can in this area. That way I am able to release everything and loosen everything up for him. Then the long back area do include the spinalis, which is what raises and bends the neck side to side, the longissimus, which extends the back for lateral flexion, and then we have the ilocostals, which flex the back vertical and horizontal. Find a little trigger point in his long back, so I'll just take my thumbs and hold some pressure on it, going deeper as I possibly can. And I do hold this for about 15-ish, 20 seconds. And then once I see a little bit of release, which is when I do notice he is licking and chewing, I will go ahead and just do some compression and then a little bit of effleurage to get everything back to where it's supposed to be. Next, I will move on to the neck, and there are multiple different muscles here. We have the rhomboid, which is a really thin muscle that is at the top of the neck, and it is what suspends and supports the neck. So I will do a lot of compress and glide techniques. I will do some cross fiber friction as well as circular friction. And then the other neck muscles, which includes the brachiocephalicus, we have the cervical serratus as well as the splenius. The brachiocephalicus is what brings the head and shoulder closer together and arcs the neck correctly. And then the cervical serratus and the splenius is what lifts the forehand and extends and arcs the neck. And again, in these muscles, you'll want to just do some deep effleurage. And then you can also do some compression and some circular friction as well. After my effleurage, I just use my fingertips and go up and down the neck. I'm using a lot of pressure just to kind of see how much he can tolerate. And the more he can tolerate, the better, because I can get deep into those muscles with my fingertips. I do not have anything jumping out at me as far as trigger points in this area, so I then just start doing some compression with the palm of my hand just to kind of change things up a little bit and get him a little bit more comfortable. My fingertips and kneading down the neck, and then I do some muscle combing. I take my hands and I spread out my fingers and I just go in a nice long stroke up the neck, and I'm using a good amount of pressure, and I did get a little bit of licking and chewing. So I know some type of soreness was being released at that moment. And then I kind of just play around with them. I do a little bit of circular friction with the palm of my hand. I do a little bit of compression, and then I just take my fingertips and knead around his neck. To the shoulder, I do some effleurage downwards just to kind of warm up this area a little bit and see if I can find anything that'll jump out at me. Multiple different muscles in this area, so it is important that you are able to massage them all correctly. We have the supraspinatus and the infraspinatus, which is what covers the shoulder blade. And then the muscles that cover those muscles are the deltoids and the triceps. And these muscles are what supports and stabilize the shoulder joint as it opens and closes while the horse is moving. palm of my hand in this area and doing a little bit of compression and some effleurage with it, just to kind of stretch these muscles out and get them all loosened for him. I do get on and off licking with him, so I know that he is enjoying this and relaxing. Find a little bit of a stress point, so I take my thumbs again and I just hold them in place and go deeper and deeper, making sure I can get some type of release from it. And I do hold it for, again, about 15 to 20 seconds. If I need to hold it longer, I will. And then I will release and do it again. And then once I do see him licking and chewing and I do feel that release, I'll just go ahead and knead it out. Do some kneading in this area. I typically get a lot of good responses from the horses and they do seem to enjoy it, so I will go ahead and knead a little bit. After doing both sides of the horse, I will then go on to doing the haunches, and I will begin at the loins of the horse. And in this area, you will just want to do some effleurage as well as some friction, nothing too crazy. In the area, we have two different muscles, and that is the quadratus lumbrian, and then we have the ilocostals. And these are what supports the lumbar vertebrae, and if the horse is sore, you will want to do a lot of press and glide. But since I only feel some tightness, I will really just do some cross fiber friction, as well as if I see anything, I will do some fingertip pressure. Deep into his loin area with my fingertips, I am feeling a lot of loosening. He ended up lifting up his hind leg, so I know that he is relaxing from this. And I do see that he is having a quiet eye and overall just seems to be feeling better. To the croup area, which is the tubersacral, and that is when both sides of the pelvic bone meet. And for this area, you really just want to do some direct pressure and some friction. Haunches, I then begin to reach the hamstring attachments. We have the upper and the lower attachments. They are the same muscles, which is the biceps femoris, the cementaniodosis, the sembramianosis, and these are what moves the hind leg forward and back. And I obviously will just do some effleurage, warming up this area again. I then can also do some compression. I can use the palm of my hand, my fingertips. I can do some muscle combing, and I can either go with or across the muscle fibers in this area. And if these muscles are sore or stiff, they do prevent proper reach of the hind legs, which is what I was personally seeing as Hanley was on the lunge line. So I will be doing a lot of focus in this area because I think that will be the best for him. I do like to do a lot of kneading, especially in the lower attachments. And then I also like to do some muscle combing, which is when I take my fingertips and just do a slow motion going upwards. I will knead the stifle area quite a bit because I do feel some tightness there. So I will just focus on that, and I am using a lot of pressure, and he is not reacting in a painful, so I am assuming that he is not sore. Do a little bit of compression with the palm of my hand, and I am going from the top down to the bottom, and the reason why I do that is so the blood flow can go from the top of the haunch all the way down to the hoof properly. Then finish off this area with doing some kneading, that way I can finish loosening everything before I move on to the other side. Moving on to this side, I again do a little bit of effleurage, I do some muscle combing, I do some fingertip compression, and then since I do feel quite a bit of tightness in this area, I do take my fist and do a little bit of compression with it just to get a better pressure point and a broader area at once, and that seemed to have definitely have loosened up a lot better. Next, I will move on to the adductors, and that is the gracilis muscles. And these are responsible for lateral movement, which moves the limbs back towards the center of the horse. And here, the horse is very rarely sore. It's usually just very tight in there. So you will just want to do some kneading, and I will use my fingertips for that. And with him, he does seem very tight back here, so I will use a lot of pressure with my fingertips. And he really does seem to be enjoying the loosening of them as he is licking and chewing. Moving on to the chest muscles, which are the pectorals and is what flexes the front leg. And here you will want to move from back to front, and you will do some effleurage as well as a little bit of kneading in the chest area. And then next we have the groin area, and we do the same thing as we do with the chest area. We move from back to front with some deep effleurage. And there are a couple different muscles in this area. We have the internal oblique, which is the sling of the intestines. We have the external oblique, which actually expands the lungs and the rib cage. And then we finally have the rectus abdominis, and that is what supports and helps lift the back. To finish off the massage, we end at the tail. And the four muscles in this tail have different responsibilities, such as one pulls the tail down, one elevates the tail, one moves it to the left, and one pulls it to the right. And for here, you simply will just take the tail at a 45-degree angle, and then you will just move your fingertips up and down, kneading the tail. You will just take the tail, and what you do is you just take your hands and hold the tail properly, and then just do a little bit of vibration with the tail. And that will conclude our full body massage.